Every morning, the doctors, fellows, and residents in the pediatric unit at Johns Hopkins Kimmel Cancer Center sit down to review their patient's status.
All right, who's next?
Olivia is our 17-month-old, previously healthy female, referred to the emergency department by her pediatrician.
We suspected ALL just looking at the morphology.
17-month-old Olivia Blair was admitted 24 hours ago. She was immediately diagnosed with acute lymphoblastic leukemia.
So I think we'll, have a little bit better idea of things after the procedures today, and then we can sit down again and talk some more.
We had been wondering what was going on with her, so we were looking for something to make it all tie together and make it make sense. She just seemed like she was sick all the time. You could tell, like, there was definitely something wrong. This is not normal. Like, she was a pretty healthy child, up to that point.
I just felt like I was giving her Tylenol and Advil every single day. Then she started to have that cold, 104 fever. She scared me.
Hope, and we think that she's going to be low risk.
Yeah.
So the other things that'll help to determine her risk going forward is, number one, the spinal fluid test. We need to make sure that there's no leukemia in there.
The bone marrow, where we normally produce blood, is kind of like your lawn. And leukemia is like weeds, so leukemia can overtake the normal grass and kill it. So it's not enough just to mow the lawn. You've got to go and get the roots of all of the weeds and get all of the leukemia cells out in order for the grass to be healthy again.
We'll take some local anesthesia.
It's not a perfect scenario. The treatment is tough. It's a long treatment. It's tough treatment.
Okay, phase 2.
Olivia's treatment has to begin immediately before the disease progresses too far. She receives her first dose of chemotherapy directly into her spine.
Breathe a little funny because she's sleeping so deeply, okay? So sometimes just because she's not fully awake, you kind of have to stimulate her, take those big breaths, and it's just because the anesthesia's wearing her out. Do you want to come have a seat on this side?
I started to pinch myself. Like, wake up. This isn't happening right now. That's not my daughter. She's not sick. That's not my daughter out there. Like, she's not going through this right now. This isn't happening. No.
For most parents, it is their worst nightmare. And our job is to help them recognize that while this is obviously a shock and something that, will turn their world upside down, it's something that together we have to figure out a way to work through. They've got to be able to function as parents now more than ever.
No one has a manual for trying to figure this all out. You're thinking that, is my daughter gonna die?